Hello, hello. Can't seem to see anyone.
Hi, Lou.
Hello. Hey, Binosh. Hmm,
Good, yourself?
good. Lovely to see you, and thank you for having your camera on. I will ask everyone to pop their cameras on so I can see you. Got hi, Haley. Oh, Peter. Sorry, you've just changed your name. Thank you for changing. Hi, Shane. Hi, Megan. Hi, Josh. Now, if you've got multiple people in the room, if you could please rename yourselves so I know who I'm speaking to. I'm just going to hit record as well. Bear with me a moment while I do that. If you're not certain about renaming, if you click on the three little dots on the upper right side of your little video square, then you will be able to rename yourself. And for some reason, I can't find my recording, which is strange. There, oop, hang on, let me try this again. Sorry about this, guys. We'll get started very soon.
Recording in progress.
Okay, so we do record these sessions mainly for our internal purposes. We're not sharing these ones, so I hope you've all got your pens handy. So if you haven't met me before, my name is Louise. I'm a coach and consultant and trainer with Prime Practice, and before that, I worked in dental practices for 20 plus years as a dental assistant, front office coordinator, practice manager. So I get the ups and downs and all of the various things that come with working in a dental practice. So can I just see, can someone just give me a thumbs up if you can see my screen there? Amazing. Thank you, Shane. Excellent. So we've still got a few people who are off camera. If we could see you, that would be amazing, because we're going to have a big conversation today around appointment book control. So the most important system in your practice. All right, let's get into it. And also, I should point out the chat, and I'll go through it a little bit, but you've got a chat function there, so do feel free to say hi, where you're from, what you're hoping to get out of the session today. But let's get into it. So we'll start with some housekeeping, of course, always housekeeping. We'll have about an hour today of training, and then we'll go into a Q&A at the end. If we don't get to answer your question, or you have something more substantial that you would like to talk about, you can take that up with your coach, or let us know, and we can try and arrange to support you offline. Thank you to those who have cameras on. It does make for a far more engaging experience when we can all see each other. So, and thank you for being on mute as well. I do hope that it's a session where you'll all be able to share. So at some point, I will invite you all to come off mute and, pitch in with an answer and things like that. There is a reactions tab that you'll see at the bottom of your screen. Do feel free to, I think Banush found it before with a thumbs up. Give me a thumbs up and tell me if, how things are going, but do feel free to explore the chat, the emojis, all of those things. Now, I hope that you all had an opportunity to go into Prime Learn to get your worksheets. Did everyone get to go into Prime Learn? Give me a bit of a thumbs up or a nod. No, that's okay. It's a good thing I had the worksheets prepared earlier. So look, I'll let you off the hook this time. But there, Prime Learn is where you'll go to actually get your certificates, to do the quiz and get your certificate, just to demonstrate that you have completed the course. So please do check it out after the session. For anyone who doesn't have a Prime coach already, I'll be giving you a call in a couple of days just to check in to see if there's any support that you need or any clarification that you need after today's session. So, what are we going to be talking about today? So, we're talking about controlling the appointment book with a proven approach. We're going to discover the difference that pre blocking and running on time will make to your appointment book. Because, as I said before, the appointment book really is the foundation of your practice. It's the most important system to get right. If this isn't working well for your practice, then nothing else is really going to work well. So, a effective pre-blocked appointment book really is the glue that holds everything together. So let's start off with a poll, and I would like to know, what does your appointment book impact? Hopefully you can see the poll there. Can everyone see that? Yep, people are leaning forward. Excellent. So what does your appointment book impact? Is it the team stress levels, the working environment? Is it the quality of the dentistry provided, the practice finances, the quality of the patient experience, or is it all of the above? So we've had a couple of people voting now, and you're all very clever. Absolutely. It is all of the above. Thank you, everyone, for participating there. So you can see 100% said all of the above. And you're right. It affects everything, your working environment, your stress levels, the team stress levels, the type and quality of patients provided, finances, life generally, and your desire to get up and come to work every day. So it's a crucial system to get in control of. Question for you. If we say to a patient, when would you like to come in? Who's controlling the appointment book? Does someone want to just come off mute and answer that question? If we say, when would you like to come in? Who's in control? You can just wait.
Patient.
And John,
Patient.
we're all going now. Who's in control?
Patient.
The patient, absolutely. So we need to make sure that we're not handing that control over to the patient. We don't want them to be controlling our working life. It also makes you sound like you're not busy. If you can say to the patient, oh, when would you like to come in? And they, are absolutely free on any random time that they want, it makes us look like, we don't have a lot going on, which of course is not the case. We're very busy. Oh, just welcoming a couple of new people there. Thank you for coming in. Please pop your cameras on. We'd love to see you. We've just done a quick poll to find out who's what the appointment book controls, which basically the answer is everything in your practice. And we're talking about how we want to maintain control over our appointment book rather than the patients. So that's what today's all about, finding control. And we can't give you a really clear instruction as to how to set up your template, because obviously every practice is different. You might be in the city, in a rural area, you might be a large practice, a small practice. No two appointment books are ever going to be the same. And different clinicians will, want their templates to work differently. But you'll get closer to your ideal day by planning everything effectively and strategically, really reviewing it and tweaking it as you go. So we'll have happy patients and we'll have a happy team. So life is so much better when we have those two things. So a lot of people who are managing the appointment book think that, just having a full book is ideal, fill all of that white space. I really invite you today to take on newly that you can create your ideal day and look at all of the pieces of the puzzle that go into creating that. So when you look at these two people on the screen, how would you prefer to feel? Do you want to be chaotic and feeling a little bit out of control, or do you want to be feeling cool, calm, and collected? And so you can actually see this reflected in the two appointment books. So in treatment room 1, we're back-to-back appointments with short turnaround times. Treatment room 2, we're starting the day with a huddle. We're getting organized from the outset, and then we've got some longer appointments. So we'll get into the whys of that, but if you think about how your days are when Is there a shared screen? Am I not sharing my screen? No? Well, oh, okay. Let me try that again.
See your screen.
Sorry,
I could see your screen.
you can see my screen?
Yep.
A message from Josh, and is it, I don't know how to pronounce the Irish names. Is it Aoife?
Aoife.
If we can't see screen. Okay, let me try that again. All right, so I've shared that now, and yep, everyone can see. Beautiful, excellent. Thank you for that. If I'm a bit delayed on the chat, I apologize. I'm looking across different screens and windows here. Okay, yes. So basically, we really want people to feel cool, calm, and collected, like this lovely smiling woman on the right there. And above it just being the way that our front office coordinators are feeling, the reason that we want to template our appointment book is that you have a more chaotic day. So that first example, back-to-back short appointments, higher chances of running late, backlog in the steri, busy reception, diminished patient experience. Without a pre-blocked appointment book, there are days when there's going to be loads of patients coming in, and then there'll be other days when there's just a few people coming in. It's up and down and no rhyme nor reason. So on the days that there's a high number of patients, 15 to 18 patients a day, have a think about what your production's actually like, because we might think that it's going to be high, but in actual fact, when we have a high number of patients, we have a lower production level. And sometimes when we have a low number of patients and longer appointments, that's when we can start to see our production levels increase. So we don't want to have this chaotic up and down. What we really want to achieve is something that is far more manageable, far more pleasant. So, what does it feel like when you have just a small number of patients today and doing high value treatment versus seeing a large number of patients in the day? We're going to feel like it's far more manageable, that we're doing a variety of interesting work and more of the work that we want to be doing to have a successful business. We're going to start on time, run to time, end on time. People get to go home on time, which is always a lovely, lovely motivator for the team. So like we said before, if we have happier patients, we'll have a happy team. And ultimately, we want to get to this blue line. Something pre-blocking is going to help us to get a more even line. It's not going to be flat. It's not going to be the same every day, but you're going to have more ideal days more of the time. So, you're having things that are closer to an average day that are more predictable. And so, as I said, it's really better for everyone. And as you go through this process, please don't put pressure on yourself to get it right from day one. It is something that is going to be tweaked over time. And we want to celebrate it when it works as well. We want to reflect on how we're going, what's working well, what didn't, and then constantly work towards this ideal day. So every appointment book is going to look different. The key is getting your appointment book to reflect your ideal day. And then we want to maintain it. So, is it about filling the day or creating the ideal day? We say it's about creating your ideal day. Okay. So does everyone sort of agree that that's a good idea, that it's possible? Excellent. Okay. So step one of this is 3 steps to achieving your ideal day. And we're always really strategic about this so we can manage things well. We want to make sure that we're starting off with knowing exactly how long we need for appointments. We need to talk to our business owner or the dentist, associate dentist, around the daily goals that we're going to be working towards, because that's going to have an impact on the type of treatment that you're templating into your day. Does anyone already have a template in place? Can I just see a show of hands? Okay, so one, and maybe somebody wants to pop in the chat if you don't have your camera on. Brett, thank you. Yes. Okay, so we've got a couple of people who are running your appointment books with templates. This is great. And don't, there's something here for you too as well, because it is this constant tweaking process and a constant educating of the team to maintain what you've put in place. So 3 steps that we're going to go through today, also frustrating, Brett. Okay, we can get into that. I'm keen to, Brett, actually, do you mind, Brett, just coming off mute and telling us what's frustrating?
So we use Dental for Windows. Can you hear me?
Yes.
We use Dental for Windows, and we had all of our clinicians, our dentists, to map out their ideal day, which they've done. However, the frustration that I have is, number one, putting it into the system across the span and going far enough in advance. We are quite a really busy clinic, so we're already booking into April, May at the moment. But when it's then having that book blocking in, but then clinicians will come with different things. So then you've got to restructure the day with the book blocking that's already in there, which you might have people already in there, which then doesn't flow properly.
Okay, thank you, Brett, for sharing that. That does sound really, really frustrating. So we're actually going to address this process as we go on. And look, it's a definite, as I said, a work in progress, and it takes time to get it in place. So when you start the process of implementing a template into your appointment book, you almost need to come into it and go, okay, well, it's going to take probably 6 to 9 months.
Yeah.
Get it into the swing of things, because hopefully we're booking our active maintenance appointments 6 months in advance and things like that. So I really invite you to be patient with yourselves as you're starting the process, and hopefully, Brett, we've got some good tips for you along the way, especially when it comes to the clinicians coming out and tweaking the appointment book. So thanks, Brett, thanks for sharing. All right. So we're going to, step 1 is determine our procedure time so that we know how long we need to schedule appointments for. We're then going to set up our daily template. And once we've got that in place, and as Brett, just said, it's a lot to get it in the appointment book. So when it's there, we want to make sure that we're set up to implement it and maintain it well. Okay, so starting with determining the procedure times, and I'll invite someone to come off mute. Do any of your clinicians consistently run late or finish early? I know that we've got some late. Hello.
Yeah, I have one most of the time running late.
Running late, yeah. Okay. Thank you. Does anyone else know what that feels like?
I think we do pretty well. I do run a pretty tight ship, but I do think we do pretty well with not running too late. But I think the lateness is just sometimes when things can't be avoided. So running late's not a huge thing. Yeah.
Does anyone ever run early, Brett?
Sometimes our hygiene department can run a little bit early. Yeah. Sometimes the emergency appointments are not as dire as what we thought they was, so they couldn't be quicker. But yeah.
Okay. Excellent. So because you do have that, variance of running on time, running early, running late, and you're right, Brett, there will always be the exceptions to the rule. However, we want to start off on the right note and figure out if we are actually allocating the right amount of time. We don't want dentists to be or clinicians to be running late, because then we've got that impact on our patients and on the team. And if we're running early, then they can be sitting around sort of, twiddling their thumbs and not utilizing the chair to the optimal degree that it could be. So you can find this template either in the back of your workbook when you go into Prime Learn, or I will copy it here. So I've just popped that in the chat. And I'll also copy the instructions over. So hopefully you can access that. So what you want to do is to go through these procedure times and really make sure that, one, you have consent from the clinician to record the timing, and then the DA selects the procedure time and then the procedure to time. And ideally, we don't tell the dentist when we're going to do it for that particular procedure, because dentists and clinicians, they can get a little bit, competitive when they're being timed. They want to know that they're beating the clock. And so we just want it to be a very normal day. The point is not to rush anyone. It's not a race. We're just trying to get accurate timings. So each procedure that's timed should really be timed sort of 4 to 6 different occasions in order to calculate the average procedure time. From there, the DA should also time the visit from the moment the patient gets seated in the treatment room until the treatment room is ready for the next patient. So we're including that changeover time as well. So we only want to use procedure time. We only want to time the procedure times where there's no complications, because obviously we know in dentistry things do happen. And so those things should only happen occasionally. And we don't want to waste time in our day accounting for things that could go wrong when they typically don't. So we want to use this procedure timing sheet to record all of the timings. And of course, this is a work in progress. So you might find that you need to repeat this multiple times over the years. If, an indicator of when you need to retime is if people start running late or early again. And, that this isn't to say that if you need 70 minutes to do a crown preparation, that's what it has to be, always. So if you have someone who's feeling more anxious and think they need a little bit more TLC, of course, you can tweak that and give them a little bit more time. Okay. So setting up your daily template. So we're going to create this in partnership with the clinician around all of the different variables, the preferences of when they do their treatment, lunch times, the team, and the patients as well. So what is it, do you think, that you can pre-block? What are some things, and I just invite you to come off mute or pop it into the chat. What are some things that you can pre-block into your appointment book? We sort of heard things earlier when we saw the little examples there of what we can pre-block, but what is it? I'd love to invite someone to let us know. I think I lost Brett just then, but oh no, there he is. Brett, new patient, Megan, thank you. New patient examinations, emergencies. Brett, what do you pre-block?
We pre-block all of so we have a CEREC machine. We pre-block all of our crown and bridge, and then the cements afterwards. We do our root canal, restorations, issues, pretty much all of it.
Everything. Yeah, absolutely. Thanks, Brett. And Peter, can I invite you to come off chat and come off mute and share? Is there anything that hasn't already been said that you pre-block?
No, we pretty much do emergencies, new patients. We kind of don't do RCT and crown as separate blocks. We have what we just call a pre-block, which is a value. So instead of a crown or an RCT or to book that appointment, it has to be over $1,000 to use that time.
Yeah, great. Thanks,
got a bit
Peter.
more flexibility for patients with timing. We pre-block our huddles, our meetings, and all that stuff.
Lovely. Thank you. So look, you've really gotten a comprehensive view of what you can pre-block there, because you can basically pre-block anything except the unpredictable. So I love, Peter, that you mentioned huddles and team meetings. You would have seen in that example in treatment room 2 that there was a huddle to start off the day. These huddles and the team meetings, they help the team to have the structure. Having the appointment books set up this way, it allows the front office coordinators to know when they might be able to do specific tasks, follow-up calls and things like that. If they know that the clinicians are going to be in a longer appointment, they might then have some opportunity to do some of their tasks. So it really is useful for lots of reasons. So absolutely, there's so much that you can pre-block. Today, we're going to focus on 3 key pre-blocks, which are production, and sort of that was what Peter mentioned around the rest of the root canal treatment and the crown preps and things like that. We would call them like a higher value time in the appointment book. So we're going to focus on the production, emergency blocks, and new patients in this section. Those are our big rocks, as author and speaker Stephen Covey would say. So just going through, I think we spoke about all of those. So I mentioned Stephen Covey and the big rocks. I don't have time to show you the whole video, but it's a great video to show your team. And so if you just Google like Stephen Covey big rocks on YouTube, this will come up. So in this video, he demonstrates the importance of prioritizing the big things in your life first, calling them big rocks. So big rocks are different for everyone, but they're things like, your loved ones, your career, your children. He demonstrates using these buckets of green sort of sand that you can see there on the screen, that when you prioritize the small things first, so the sand and the pebbles, it's actually harder to fit in the big rocks. Further along in the video, he shows us that when we prioritize the big rocks, then all the little things, all the little things just tend to fall into place around it. And so this is similar to how we can view our appointment book. We want to make sure that we're putting the time aside to do the treatment that best serves the patient, and in turn best serves the practice and us as a team. We're really quite lucky in dentistry that what is good for the patient is good for the practice. So Stephen Covey says, if the big rocks don't fit in first, they aren't going to fit in later. And this is what happens in our appointment book as well. So we really want to make sure that we've got time set aside for our big rocks. So a few examples for you of what this might look like in various appointment books. So I'm hoping you can see all of that reasonably well. So the lengths of the blocks that are in here are just examples. But one thing you will notice is we've got active maintenance in here. So we call it active maintenance. Other practices might call it exams or cleans, recalls, but we don't want to call it that because what happens when a car gets recalled? There's something wrong with it. So we like to call it active maintenance. But you'll notice there's no more than 4 in a day for any dentist. The reason that is because we want to allow for new work to be generated. So if your day is full of back-to-back active maintenance appointments and you're a dentist, it's probably a good time to ask yourself, is there opportunity to bring in a hygienist or an oral health therapist? Because we need space in our books to generate new work. Anytime there is a white gap, then that is when you can put anything in there, because that's the sort of fills the gaps around our big rocks. That's like the sand and the pebbles, so to speak. Use white time for things like fissure sealants, crown inserts, extractions, splint fits, impressions, scans, things like that. So you'll notice we've got longer times for our production, we've got new patient examinations, and we've got emergencies. So I said it before, some of you had come on. Before I was a coach and consultant and trainer for prime practice, I worked in dental practices for many years, and always I tended to gravitate towards prime-based practices. And so, I've lived this in the practice as well as now sort of talking about it. But when I first saw this appointment book structure, I thought this is super rigid, and I was really skeptical that it would work because patients have different schedules, right? The good news is that this isn't as rigid as what it does look like. So there's room for flexibility within the day. You can move pre-blocks around, swap from morning to afternoon to accommodate a patient. If we look at treatment room 2, There is this one in the middle here. You know, say we've got a new patient who's a teacher who can only come in after school around 3:30. We can move that 2 p.m. new patient examination down to 4 o'clock. It's not a problem to have some flexibility like that. But there are rules around what you can't do. So you can't delete that new patient examination out of the day because you need to book in, 3 hours worth of restorations and then go, oh, well, I'll put it in next week. You've got to keep the integrity of the appointment book. You can't cut down a production unit into pieces. So one of those 90-minute green high production times, you can't go, oh, okay, well, I'll just put, 3 fillings in there because it's the, same amount of time. The reason that we don't do this is because it helps us to keep, one space for our high production work, which is often longer appointments. But we then know we're bringing in more of a consistent income stream into the business. And that we're doing all those things that we spoke about as well, having a more streamlined, smoother day. So it's one thing to put this template in place, and it is another to make sure that it's maintained, which is, comes to Brett's point about people coming in and going, oh, actually, no, just change that about because I want to, fit this patient in or whatever. So pre-blocking isn't limited to dentists either. You can pre-block time in the OHT or hygienist books for, treatment if OHTs are doing treatment, new patient, professional cleaning, deep cleaning, Zoom. I always found that it worked well to have kind of coordinated appointments where you could do your examination first, and then they could go over and see the hygienist straight after. Every practice works a little bit differently, but what's most important to consider is if you're bringing a new patient into your practice and you're having conversations with them about, that deepen their concern about their treatment, you want to make sure you've got a corresponding time to be able to take care of them. So get them in promptly for their professional cleaning and things like that. How's all this landing for people? I'm keen to know whether or not you think it makes sense. Any questions, concerns at this point? Thanks, Josh, for a thumbs up. Does anyone think that it would, if you're not already using it, do you think that it would work in your practice? And if you don't think it worked, I'd love to know what might be a barrier. So I invite someone to come off mute and let me know or pop it into the chat. Shane, what do you think? Do you think that it's something that you could use in your practice?
Yeah, absolutely.
Yeah. Okay. And any immediate sort of, oh, this may be a problem, any barriers that come up for you?
No, not really, because we're quite new and we're welcoming anything trying new. Josh, you want to jump in? He's the dental man.
I missed the question, sorry.
Is there any, does this all sound like something that you could adopt in your practice?
Yeah, absolutely. Well, we don't have like a treatment 1, treatment 2. We just book everyone in the one like doctor. So I think having separate treatment rooms is really good.
Mm-hmm. Thanks for sharing. Okay, so keep this in mind, and go back to what I said. It's a work in progress, so you're not going to get it straight off the bat from the outset. Good question. Are you using 10-minute or 15-minute increments in your appointment book? Can someone just raise your hand if you're using 10-minute increments?
Where is?
Most of you are. Is anyone using 15? Yeah. Okay. Okay. So we've got a couple of people using 15 minutes. Thank you for that. So I really invite you use both, Brett. Interesting. Is that per clinician?
We run our clinicians separately to how we run our hygiene department.
Okay. So one's 10 and one's 15. Okay.
Yeah. It's ready.
Yeah.
for a neat view. But yes.
Okay. So look,
Yeah.
I guess as long as I'll come back to that, but I invite you to consider, if you are using 15-minute increments, to consider using 10. The reason that we invite you to consider this is because you can actually create more flexibility and more specific appointments in your appointment book. So, if you have 10-minute increments, then you have 6 possible increments within the hour. Whereas when you're using 15 minutes, you only have 4 possible increments in the hour. So you can get those appointment times far more precise, which, ultimately creates more time in your appointment book.
It's definitely something that I've wanted to implement, but it's an old behavior that I'm slowly changing.
That good old, this is the way we've always done it, so we're going to keep doing
Right.
it. Yeah, we
Yes.
see that a lot, and it can be hard. I suppose the thing is what I was going to say before, Brett, and I'm glad you shared that because I was surprised I've not really heard that happening. But whatever conclusion it is that you come to, as long as you've considered what's best for your patient and your business. So first, what's best for the patients, because what's best for the patients is ultimately best for your business. You don't want to be bringing patients in for, well, I suppose, let's be honest, this is probably more about what's best for the business, because if you can have patients in for a more correct time, then you've got a better opportunity at seeing more patients and all of those things. But this is not about squeezing in as many patients as you can. It's just about using the time most effectively. Excellent. Okay, so for anyone who's using 15 minutes, pop that down as an action to consider 10. Excellent. Let's now look at production pre-blocks. So we kind of touched on this a little bit earlier, but the production pre-blocks, they're different to general dentistry, and they're going to depend on the type of practice that you work in and what the clinician's daily goals are. So it is, I work with a lot of practices who say, no, we don't really want to make it about around money, and so we don't do clinicians' goals. But I really invite you to have a look at it, because you can do a lot by working backwards from those goals and making sure that you are optimizing your appointment book and things like that. Because your production goals are going to determine the number of production units that are needed each day. So a really good rule of thumb to remember is that 75% of your daily goal should be covered by production units, and then the other 25 will kind of come naturally as a result of that. So it isn't about, the owners getting a fancier car or going on a nice holiday. The truth of it is that these goals really are critical to keeping the practice going, to keeping our jobs secure. It's not about overdiagnosing either, and it's not about underdiagnosing. It's about being ethical in your diagnosis. So coming at it from that point of view of, what would I want if it was my mouth, or what would I do if dentistry was free? What would I, recommend for this patient if dentistry was free? So as I said before, we're fortunate in dentistry that what's good for the patient is often good for the practice. So having these goals, and I know I've got some business owners on the call today who'll know, but these are the things that fund the new equipment, the professional development. The whole practice really contributes and benefits from achieving these goals and keeping these templates working for you. And, we get to keep the community healthier, and keep them healthier as well. So we want to have the appointment book, the foundation, working really well so we can support all of those things. So specifically, you might have crown and bridge, implants, all on fours, root canals, veneers as your high production or as your production pre-block. So this isn't, your 2 composite fillings or your fissure sealants, and it's not even a whole quadrant of fillings. It's that more indirect work more often than not. So whose responsibility is it to fill the production pre-blocks? Does somebody want to pop it into the chat or come off mute and let us know whose responsibility is it to, if we've got these production blocks in place, who keeps them filled?
I think it's everyone's responsibility.
Everyone? Is everyone saying everyone? Oh, bunch today. Excellent. You're right. Does anyone else did anyone else think something different? And it doesn't matter if you did, but I would be curious just to understand. No, everyone thinks it's everyone. Excellent. Well, you're right. These production blocks, they become, or our appointment book really becomes something quite, sacred as that foundation. So it is absolutely everybody's responsibility to fill them. And as for any business owners on the call or practice managers, it is, your responsibility to empower your team to know that they have an impact on this. So whether it's, the person in the steri or the dental assistant who's very quiet, everybody can impact. Okay. Excellent. So let's talk about emergency pre-blocks. So if you have emergencies calling up every day, but you don't pre-block them, how do you fit them in? So typically you'd either squeeze them in right between patients, or you'd see them at lunchtime or at the end of the day, or, worst case scenario, you can't see them and they have to try and go somewhere else. So neither of these outcomes are optimal for the practice, for the team, and certainly not for the patient who's experiencing the emergency. If you're squeezing people in, that's not ideal for the patients that are coming in after that patient with the emergency. So I want to start off by asking, and I'm just going to bring up a poll here. I want to ask you, what is the objectives of an emergency appointment in your practice? Can everyone see the poll there? So we've got two options there on the screen. Is the main objective of an emergency appointment relief of pain and providing a reason to return? Or is it relief of pain and any treatment that the patient needs? So I'll wait for a couple more responses. We're a bit neck and neck at the moment. Okay, let's give it another minute or so. All right, I'll end that poll there. Thank you, everyone, for your responses. I'll share the results. Hopefully you can all see those results there, that we've got 78% saying relief of pain and providing a reason to return, and 22% saying relief of pain and any treatment that the patient needs. So we actually believe, like most of you, that the best practice, the main objectives of the emergency appointment is to relieve of pain and to give the patient a reason to return. And we have, a section that I'm running in a couple of weeks around handling emergencies. And so, we go into this in a lot more detail, communication, and things like that. So we're just touching on this quickly, but it is hard to manage your appointment book effectively if permanent treatment is being done in an emergency appointment. So I'm glad that, a lot of people are helping patients to, give them a reason to return. So for anyone that isn't doing that, or thinks, maybe it is a bit better they should be getting the patient in doing everything. If we complete all of the treatment there and then, we're not giving the patient a reason to come back in. We're also training them to believe that they just should come in crisis situations only. And a lot of patients, because they don't know what we know, having worked, been working in the industry, is that they probably think, okay, well, I've been to the dentist check and I had that issue fixed and now everything's okay. So the other thing is when they're coming in, when they're in discomfort, they're probably not in the best frame of mind to be making decisions about permanent treatment. I mean, how many people have you spoken to in pain and they just go, I just rip the tooth out. I don't care, just rip it out. So we really want to be getting them comfortable and getting them back when they're in a better frame of mind to look at how we treat that particular tooth. It also gives us an opportunity when we're, just doing a relief of pain, that we can sow a seed of concern. We want to be able to have them motivated to come back and have the rest of their mouth seen so that they aren't going to go through this again. They can avoid that discomfort, that painful experience again. So absolutely, I really invite you to take it back to your teams. If you are doing full treatment when an emergency patient comes in, please do consider doing relief of pain only. Now, I should also say before I go on to that we know there's sometimes, when you do need to do full treatment, if you've got, if you've got swelling or if there's a trauma, of course, we understand that treatment needs to be done there. We're talking about mainly the rule rather than the exception. So when it comes to thinking about how many emergency slots you need in a day, because obviously we don't want to have, a bunch of emergency appointments that don't get filled. So if you're thinking, how do you know how many spots to pre-block in the day, then I'd suggest going back and letting the numbers give you the information. So looking at how many emergencies you'd seen over, say, the last 3 months, and then calculating the average per day. And so then that's the number of emergency pre-blocks that you'd need. And I definitely would consider, looking further in the appointment book, and after a public holiday, putting an extra one in because, all kinds of things happen when you close for a day. Another thing I get asked is, can I use is when can we fill the emergency spots? Can I, fill that for tomorrow? The answer is no. These emergency spots need to be set aside for on the day only. And that's not to say that if you have no emergencies call up that you just leave it empty. If they don't fill, then you can pull from your priority list. So that's the other thing that you need to have working in conjunction with that is a really specific, well-organized priority list. Some people might call that a standby list. Again, coming back to language, we like the term priority. If you're on a standby, say you're on a standby to get a flight, what are the chances that you're actually going to get on the flight? And you feel like you're a bit of an afterthought. So we don't want our patients to feel that. So we want them to feel like they're a priority, hence why we say the priority list. If you can't get someone in, then look, you could maybe use that time for some admin or for some training. There is always so much to do in a dental practice, but definitely pulling from your priority list is the first port of call. So where you put your emergency appointment, your pre-blocks in the template is also really important. So if you look at this example here, the emergency spots are at the end of the day. Why do you think that you'd put them at the end of the day? Someone want to share their thoughts around why you'd put an emergency block at the end of the day?
I'd like to know because ours actually go before the clinician's lunch at their request.
Okay. So thanks, Brett. Before the clinician's lunch is actually fine. We would have it before lunch or at the end of the day. And the reason being that we don't want our emergency appointments to cause the next patient to wait. So, if no one comes in at the end of the day, then you can use that time for that training and shutdown and things like that. But emergencies before lunch, before the end of the day, if you are going to run late, then you're running into, albeit it's the team's time, but you're not keeping another patient waiting. So, yep, you'd have them before lunch or at the end of the day. Anything around the emergency patients before we move on to talking about new patients? All makes sense. Yep, beautiful. Okay. So new patients. Now, even if your practice has enough patients, I know that we've got some new practices here, and we've got some practices on the call with a really long history. Regardless of where you're at, you still need new patients. So the general rule of thumb is you need one new patient examination per dentist per day, just to maintain your patient base, because people move, they rudely pass away on us, or whatever happens. But we really want to make sure that we have time set aside in our appointment book to maintain by one new patient examination per dentist per day, or if we're growing, then we need more. We could double that, or even just half again. But we want to make sure that we've got time to be seeing these new patients. So moving into that, and again, similar to the question I asked around the emergency times, why would a practice put new patients at the end of the day? Or actually, this question is a little bit incorrectly phrased, but what would happen if you put a new patient, say, at the end of the morning session or at the end of the day? What's the risk that you run?
If you're running late, then you're running late for a new patient.
Yeah, absolutely. So you're not setting that patient up for a really successful appointment to have a great experience with you. So we would always say put your new patient examination pre-blocks at the start of the day or just after lunch, so that you're seeing people on time. And also when you're a bit fresher too, you're fatigued at the end of the day. So seeing them last thing, it's a hard kind of task to then build the relationship and have the conversations, after a full day. And again, do consider adding those new patient pre-blocks into your oral health therapy books as well. So making sure if you're putting, 15 in a week, depending on how big your practice is, that correlates in the hygienist's book as well. And again, pulling from your priority list for anything that doesn't fill up. So Brett mentioned it earlier around violating a pre-block. When do you violate a pre-block? When is it okay? Brett said that it's when the dentist comes out and tells them to.
If we haven't filled a pre-block 1 or 2 days before, we'll clear it and put other work in.
Yeah. Absolutely. Is there any other time? So, Peter, you are correct. The only time that you would violate a pre-block is if it is not filled 24 to 48 business hours in advance. Other than that, you don't violate a pre-block. You can shuffle in the day like we talked about earlier, but the dentists that come out and say, hey, can you move this around, please? There's a conversation there to be had as a team around the importance of the appointment book. And if you're finding that dentists are having to move things around, potentially the template is not working the way they need it to. So then re-examining what's happening there. There might always be exceptions to the rule, but as a general rule, the front office coordinator is the person who's maintaining the appointment books, and not the dentist. Much to the dentist disgust when they hear that a lot of the time, but that role does sit with the front office coordinator to manage the appointment books. Okay, and for anything else, if there's any ifs or buts around that, I definitely invite you to have a conversation with the team around what may not be working well if you can't keep your template the way that you've set it up. Who's doing online booking here? Just see a show of hands. A few people? Yeah, excellent. So look, we really love, oh great, so most people I think are. For anyone who I think hasn't answered me, I'll just touch on it quickly. It's a fantastic way to ensure that your patients can schedule in an appointment at a time that suits them. You know, if they're busy working or kids or whatever, and at the end of the day, you think at 10 o'clock, I haven't been to the dentist for ages, or I've got an emergency, and, you know, you always feel a little bit better if you know you're going to be taken care of. So provide your patients with an opportunity to schedule at a time that suits them. And, you know, I know it depends on the software that you're running, but you can try to work with the software provider to create the most effective way of using online booking for your pre-blocks. Now, I do also speak to a lot of clients who say, well, you know, we don't get an opportunity to build a relationship with the patient if they're booking online, and that's definitely true. So what I would say in that case is, when you see the online booking come in, pick up the phone and call the patient to get the necessary information that you want. We've got a whole nother training around best practice phone skills of what to say and what kind of information you need to get from the patients when they're calling up. But that's also your opportunity. Excellent, Brett. You call all your online appointments. I think that is best practice for sure to do that. Build that relationship, get the information that you want. And you can set that up on your website as well. You know, set an expectation that patients should expect a phone call the next business day. Excellent. Okay, so that's one for your action list if you're not already doing that. Now, moving into step 3, implementation and maintaining. So, of course, we want to make sure that it works as things change down the track. So we want to make sure that we're not setting ourselves up to fail by being too rigid or by not having enough in place. So we want to be flexible within the parameters. And I know I said 10-minute increments, but this example shows 15, but this gives you a bit of an idea of the way that you can set up your template. So think of that schedule, you know, like a jigsaw puzzle where each appointment is a piece, and you can move the pieces around to, you know, make it look different, but you can't take a large piece of that puzzle and cut it into smaller pieces. You know, you won't, you know, it won't be filled if with what you want, if you're kind of chopping things up and moving things about too much. And so again, I make sure that the team knows that it's part of just your process every couple of years to time different procedures, review the templates in conjunction with the dentist that you're working with, check in with them, you know, where they want their blocks. You know, if they know they're better in the afternoon, then work with them around that. And that's not to say that you can't swap it. Like, I've done templates on a 2-week cycle. So it's, you know, you flip it. Morning, it's, you know, one morning, one fortnight, you know, you have things in the morning, and then the other fortnight you have it in the afternoon, so that you're getting the best opportunity to really look after your patients and their needs. Okay, so look, I think, you know, I did ask earlier what people are thinking, and it seems like it is something that you can implement, or, you know, there's a couple of people who are already doing it. Anna, I think you've got your hand up. Did you have a question, Anna? That's a canoe, hands down. If you do have questions, that's okay. You can, we'll definitely have time at the end. Okay, so what are the next steps to get this underway? If you're not currently using a template, discuss it with your team. Take that procedure timing workshop that I put into the procedure timing worksheet that I put into the chat. Give that to your clinicians, to your dental assistants to time. Set up an expectation that you will be doing that, and work with your clinicians as to how they would set up an ideal day. As Brett said, you know, it can be a bit messy. and it's when do you put them in. You can pre-block it at least 12 months in advance. And if you're happy to kind of leave it that long, I would say just put it in 12 months and know that you're coming, or as soon as you've got gaps in your appointment book. I'm actually a fan of doing it a little bit sooner, because eventually, you'll have a period where it's a bit messy, but you might be able to tweak your appointment books and get a bit of a sense of how your appointment books are currently sitting in terms of production, and are you seeing the right mix of your appointment books. It also keeps it front of mind for your front office coordinators when they see the template in the book as well. So that's the other thing I would really say as leaders and business owners, make sure that you're working closely with your front office coordinators to really have them understand why we're doing this, what the limitations are, and what you can do. Having them really understanding is key for having them partner in that journey. So as we wrap up, just some final tips. So consider those 10-minute increments. If your practice doesn't have a hygienist or an OHT, consider capping the number of active maintenance appointments that you have in with a dentist through the day. So no more than 4, ideally. And really have a chat with your team about who's seeing the appointment book, who's managing the appointment book, because it should only be the office coordinators. Dentists create their own ideal template, like we spoke about. Front office coordinator maintains it. And the most effective teams have this strategic approach to managing the appointment book, looking ahead, optimizing, shuffling. There's lots of work that front office can do to keep the appointment book optimized. And it is this living, breathing, ever-changing foundation of your practice. So, I know there are times when the appointment book will support, and I probably should have mentioned this earlier, but I know there's times when the appointment book will support the dentist doing extra treatment or the whole treatment if there's an emergency, and that's absolutely fine. We are not saying turn that patient away because it doesn't fit with these things that we've talked about around emergencies or pre-blocks. However, there's a way that you can do it. So your front office coordinators will set an expectation, particularly around emergencies, that they'll be coming in for relief of pain, and they'll, get the patient back for permanent treatment. Or they might say, this is going to be like an hour appointment or whatever. And if the dentist needs to tweak that, that's absolutely fine. But sort of do it in a way that honors what the expectation that the front office coordinator had set. So you can see, look, I think I might have some time. However, I just, I'm going to go and check with Peter. She's the expert in my appointment book. We may be able to do that for you, but I just need to check with Peter first. So you can do that work that you want to do, but in a way that honors what the front office coordinator had said. So that brings us to the end of our information session. I'm just curious just to hear from each of you, what will you start doing? What will you continue doing, and what will you stop doing as a result of today's training? So if I can invite everyone to share just one of those. So something you'd start, or something that you want to continue that's working really well, or something that you want to stop doing. And I'll give you a moment to think about that. But if Brett's already come off mute.
I'm definitely going to look at implementing the 10 minutes across the board. Okay. And also, I think it was a really good idea somebody else spoke about with the high value spots. I think giving it that figure that they mentioned, like no more, less than $1,000. I think that's something I can really implement with the team, so that we're having those really high value spots still being predictive.
Yeah, absolutely. Yeah, making it known what exactly high value looks like. Excellent. Thanks, Brett. We've got some people in the chat chain adding emergency blocks at end of day. Salam, I'm not sure if I'm pronouncing that correctly. Pre-blocking better than big blocks, specifically labeled blocks. Yeah, absolutely. Making it as easy as possible for the team to work with that. Megan, allowing everyone to have some control in the appointment book. select staff only. Yes. Okay. Select staff only. Front office coordinators having control. 10-minute increments. Yeah, not allowing. I got you, Megan. All good. And calling all online booked patients. Absolutely. Well done. Thank you, everyone, for sharing. Is there anyone who hasn't shared that would like to share what they're going to start, continue, or stop? Benosh, you come
I'm
on.
going to go and talk with all of the dentists that we have in the practice about retiming and see the way that we have the blocks that are the best way that works for them.
Beautiful. Excellent. Thank you. Anyone else? No? I know that you've already got this in place, Peter. Peter and her team are clients of ours, so they've been doing these things for a while.
Yeah, one thing I will say as front office coordinator, because we've got different dentists here, and the dentist I work for, he completely stays out of the book and lets me control it, and it's much easier for me to do that than some other dentists that come and constantly tell people where to put patients. So it's, yeah, we discuss where we're having the blocks, how we're having our day set, but then once that's discussed with the dentist, then I have full control, and it does make it a lot easier moving forward without having a dentist or a nurse coming out to me every 5 minutes. Oh, can you move this? Can you do that? So
yeah,
dentist having that trust in me to do it definitely makes a huge difference.
Beautiful, Peter. And I think that trust, that is such an important word. You know, the clinicians, you're the expert in, you know, being on the tools with your patients, and empower and train your front office coordinators to be the expert in managing the appointment book. Lovely. Excellent. Thank you so much. Little quiz just to end. So what is step 1 to achieving your ideal day? And the first person to answer these 2 questions correctly, so I'll give you both questions now, and you can put the answer into the chat. And the first person to answer both correctly will win our virtual prize. So what is step 1 to achieving the ideal day? And what is one thing that you can pre-block in your appointment book? So I invite you all to put your answers into the chat. First one to answer both questions correctly. Getting the set up daily templates in emergency, having everyone on board. Yeah, it's not quite the answer I was looking for. Step 1. Remember, if you think back to those 3 things that we looked at, step 1 was, and I put a little hint, there's a worksheet in the chat about it. Procedure timing, yes. And excellent. Oh, look, you know what? You've all done such a great job today. You've been a great audience. So everybody gets to go on a virtual holiday to Tahiti. Don't forget, you know, your prime trainer today. She would like a trip to Tahiti as well. But that brings us to the end of this session. Thank you, Anna. Oh, look, you did both 1 and 2. Beautiful. I am going to, that's cruel. It's cruel. Me coming. All right. So before